Hello, and welcome back to Charlie's Chats. I know this is part 2 of 2. I know in my last video I waffled quite a lot and didn't actually say what I had planned to. So this video is hopefully going to go as planned. So I made some notes the other night, and if you see me looking down, it's just because I'm reading it because I can't remember what I've actually written. So we're talking about receiving a diagnosis and the impact that can have, whether positive or negative. And I know yesterday I was saying how, not all, just because you receive a diagnosis doesn't mean that it's either the correct one or that you have to then become your diagnosis. So I always find diagnoses quite interesting. I immediately want to say labels, and I don't know which people prefer. If they prefer somebody to say, "Oh, I'm labelled with depression," or "I have a diagnosis of depression." Attaching a label to someone perhaps doesn't seem as clinical or as professional as diagnosis, and perhaps it doesn't show the severity of a condition. Perhaps anyone can attach a label to somebody. But diagnosis, for some reason, seems to have a bit more power, to have a bit more professionalism as a way of defining traits or symptoms that a person is experiencing. So I'm sure a lot of you probably have a diagnosis, whether mental or physical. I think probably everyone has some form of ailment or symptom that they experience, whether that be on a daily basis or a long-term condition. So labels or diagnoses can be beneficial because they can help you to understand. I think this is what I was saying yesterday. Can help you understand what you're experiencing, why you're experiencing what you're going through, and it can often be quite important for people. It's almost not a sense of it's a sense of, I'm trying to think of the right word really. Just clarification that I do. It's not all in my head. I do suffer from anxiety, or I do have an eating disorder. It's not just made up. It's some professional has told me, so it must be true because they're a professional, which isn't always the case. But when people have certain initials or letters after the name, it then becomes our instinct that, well, they've got these letters, so therefore they must be really good. And it's very important that if you go for counselling, that you look for these letters, I guess. Now, I'm not saying that those who don't have, say, an undergraduate degree or a Bachelor of Arts, that they're not a good counsellor. But generally, I would say that counsellors, their fee online tends to be a lot lower than a clinical psychologist or a counselling psychologist, because a clinical psychologist and a counselling psychologist have studied a lot longer than a counsellor. You know, I've got a CBT, a diploma in CBT. I could practice as a therapist, but I wouldn't, because I wouldn't feel that I have enough experience, or that I have enough of an educational background to be able to do that. But some people do. They will do certificates online. They will, and this is where it's important to find somebody who is legitimate and not trying to convey themselves as being something they're not. So a counselling psychologist or clinical psychologist may charge, say, £80, £85 for a 50-minute or to an hour session, whereas a counsellor may charge £50 because of the lack of experience and education. And I think it's important, you need to check on the counselling website to make sure that they are accredited. And it's always good to check this first, and to also make sure that there's an initial meeting with them, so that you're not paying anything straight away. And usually these initial meetings last about 15-20 minutes, and it's just seeing if you kind of gel with the counsellor, and if you think that you can work with them and they can work with you to ultimately help you with the issues that you're struggling with. Personally, I have worked with counsellors online, and I haven't found them as beneficial or as knowledgeable as those who are charging, obviously, £85. There's a big difference. So I did find that with somebody who's charging a higher amount and who is a counselling psychologist, so a psychologist rather than just a counsellor, I don't mean just a counsellor, but rather than a counsellor, you do get your money's worth, if that makes sense. So I think that's really important. Always check them out on there. I think it's the BACP or the BPS, or there are different websites that you can check to make sure that the counsellor is legitimate. See, I'm already going off topic now. So I was saying about how everybody has some form of ailment or symptom that may be bothering them, and how a diagnosis can help you to understand treatment options, medications, and how to alleviate a person's symptoms. So let's use FND for an example. So somebody is just saying, right, you've got FND, and it's putting people into a category of you've got F and D, and therefore you must suffer from X, Y, Z, because you're in that box. So you obviously suffer from exactly the same ailments as anybody else. So it doesn't treat the individual in a person-centered way. It treats them as part of a group. And sometimes labels can actually be really detrimental to a person, because they might almost become that label. I think that's something that I used to worry about a lot. It's a bit like saying that somebody is angry, he's angry. So it's perfectly normal to feel anger. But if you say somebody's angry or somebody has an aggressive nature, that's negative, and it's considered to be a negative trait. if you say somebody has issues, it feels like it's almost long term. So this person could be angry because they've just had an argument with their best friend or something. And you know, that could be, you know, five minutes or something, and they return to a sense of calm, and they've cooled down and they're calm and collective, and they're no longer angry. So there are particular diagnoses such as personality disorders, which some have very negative connotations, and you're expected to receive a negative response when you say you have a personality disorder, which shouldn't be the case. It could be, say, oh, she's got so she could have narcissistic personality disorder. So she's got, this person has this diagnosis, narcissistic personality disorder. Oh, yeah, you're put into a group, so it'll be, oh yes, yeah, she's one of them. She's one of them. She's a narcissist. She's that person. And they're using the actual diagnosis to almost rename that person. Or emotionally unstable personality disorder, EUPD. She's EUPD. And when I say she, I'm referring to professionals. And I've heard it mentioned. And I've heard professionals refer to people as their label. Which, you know, well, that person isn't a diagnosis. You can't be a diagnosis. You have a diagnosis. I find it so frustrating because you're automatically put into a category of people, and it's assumed that you're going to behave in exactly the same way as them. So you're almost trying to prove to people that actually, yes, I might have the same diagnosis, but it doesn't mean that I'm going to behave or act in the same way as somebody else. Not everybody with depression will behave or have the same traits. It's not like everybody who has cancer is going to have the same type of cancer, the same surgery, the same treatment, or the same experience of or the same feelings about it. It's not like, so mentioned depression, it's not like depression is going to experience it the same way. Some people may function differently than others. Some may have more support than others, and some may not receive a diagnosis because they haven't been to see a healthcare professional. But they may still be depressed. Just because somebody hasn't been to a doctor doesn't mean that they don't have depression, anxiety, MS, just a few things. But I think if you become your illness, you lose a sense of yourself. You're almost giving into it, saying, okay, yeah, that is me. Forget the fact that I'm Charlie and that I actually have hobbies and interests and I like certain things and dislike certain things. It takes away my personality. It takes away my identity. I'm no longer Charlie. I am my diagnosis. And that is something which I will leave you with. So please, please, please remember, you may be diagnosed with something, but you are not your diagnosis. If you were to meet somebody and introduce yourself for the first time, you wouldn't shake somebody's hand and go, hi, I'm depression. Hi, I'm anxiety. You wouldn't do that. You'd say, hi, I'm Charlie. Nice to meet you. So don't lose a sense of yourself. You are you, and you're great, and you need to remember that. Every time you look in the mirror, my grandma always said, you say you're beautiful. So hopefully you can take something from this. And next time you're either walking past the shop window and you see a reflection of yourself, or you're in the bathroom and you glance into the mirror, look into the mirror. Look into that mirror and say, I'm Charlie. I'm beautiful. I'm Charlie. Oh, look at all these compliments I've given myself. I'm Charlie. I'm funny. I'm Charlie. I'm not my diagnosis. So please join me for the next Charlie chats, and hopefully you guys will leave some comments, advice, anything you want to talk about or discuss that I could bring up in a video. Just leave a message, and yeah, that's it for now, folks. Bye.